The Center for Information Technology and Development, CITAD, held a meeting with state commissioners for health in Abuja to share experience on COVID-19 vaccination exercise in the state and the way forward. On an interview with the Executive Director, Center for Information Technology and Development, CITAD, Dr. YZ said, in all the states present, there are radio stations that are running public education programs, providing information, demystifying misconception and misinformation of the COVID-19 vaccine. However, Dr. Lauri Selin of Adamawa State said they are playing major roles in the acceptance of the vaccine because many are misinformed about the COVID-19 vaccine. Also, Dayo Laide of Manhattan Foundation said misinformation needs to be addressed.
I think we have noticed quite a number of improvements. We have seen even in states, for instance, in Kogi, where there was total denial, we've seen leaders of traditional leaders that we have visited come out to be vaccinated. We have seen, for instance, in Bauchi, where the Federation of Muslim Women established a vaccination center in conjunction with the state government, so that people could not just go to hospital or any, but visit their own offices. We have seen quite a number of improvement across many of the states running up vaccination. But that is not to say that there are no challenges. There are still quite a number of challenges that need to be addressed, even as we recognize that improvements are being recorded across the different states.
Adamawa State, like any other state in the nation, has the issues of the hesitancy. It also is playing a major role in the acceptance of the vaccine, because many people are still being misinformed about the vaccine. So we are having cases of rejection amongst the people, amongst the populace, even among the health workers who are supposed to be the ones sensitizing the populace. We're still having issues with acceptance amongst our population.
As a specialist, what will you see the implication of this to the community in general?
Well, that is definitely going to affect the acceptance of the vaccination and then the coverage. And you know what we are trying to achieve is a certain percentage should be immunized, so that there will be a herd immunity in the community. But if we don't have that percentage, then we will still have a problem with COVID in the society. So if we fail in that aspect, then COVID will still be an issue.
So what is the government doing to overcome these challenges?
The government is creating awareness through community mobilizers. They are going in, community mobilizers are going to the community to sensitize the people as to the importance of taking the vaccine. The government is also providing funds for the health workers to be able to go around and vaccinate the populace. And they are creating the enabling environment for the health workers to carry out their function. They are also showing good example, like in the case of where if the governor goes for his first and second dose and even the booster, to be broadcasted to the whole people to see. You know, that will go a long way in improving uptake by the community. So the government is playing a major role in the acceptance of the vaccine.
Thank you very much.
What is your take as a medical professional?
Okay, my advice to people is that they should open up and get to know more about the vaccine, the fact that the vaccine is being given to us to protect us, and it's not going to harm anybody, and that despite taking this vaccine, it does not mean that you are not going to come down with COVID, but it's going to protect you from getting the severe form of the infection, and it may also help to reduce hospitalization. So my advice to them is that we should all try and take our first and second jabs, and then the booster for those that need to take that.
And then again, you can connect to security. In Kebbi State, for example, there was a mention of a number of local government areas where conflict makes it difficult for even those committees, in spite of all the innovations in the state, to be able to reach rural communities and give them the vaccine. And then talk about vaccine hesitancy among health workers as well. That is also a major challenge, as well as payment of health workers. So it's a combination of things. But the good thing really is that data is telling us stories. What do we do with those stories becomes the next, the most important question. What do we do to translate what data is telling us into actions that can improve the system and enable the state respond to those gaps as quickly as possible for them to be able to meet their target?
Part of the agenda for this meeting is for us to identify the challenges and then discuss how we can collectively address those challenges and see what sort of things we will do. But even independent of this meeting, we already have other things that we are implementing in all the states that are present here. We have in each state a radio station that is running the public education programs, which is a weekly interactive radio program providing information, demystifying the misconceptions and misinformation about the vaccine. But we also support what we call influencers, at least 3 in each of 6 of the states. We also have some mass organizations that we are supporting working in those states, so that together you can raise public consciousness and awareness about the safety and efficacy of the vaccine. We also have what we call champions. These are young people having recognized that much of the misinformation about the vaccine is on the social media. We have trained a group of young people from the different states so that they will constantly be posting, countering misinformation posts. And we have partners who dedicated themselves to tracking and converting the misinformation, so that they feed that information to us, and then we feed it to the champions who would carry it out and post it in the different brands of the social media. We are also working with the Association of the Governors to see what joint activities we could do, as well as deepen our engagement with the state ministries by offering training programs for the health workers, and also helping with technology related issues like dashboard, so that they can be able to monitor the movement of drugs and vaccine and its utilization and so forth across the state.
So the goal of our support to CTAD and a few others that are working with cut across a number of things. One of them is actually to address the misinformation and disinformation. A lot of people that are aware of the vaccines or that are aware of the virus itself, COVID-19, associate so many different things to it. So one of the things we wanted to do is actually to educate the public. What is the virus and how it affects you? And what is the vaccine and what can the vaccine do to you? That's a core part of what the support to CTAD is seeking to address. But going by the experiences shared this morning, quite a number of things are working well. A number of things are still outstanding that needs to be improved. quite urgently if the targets of the states and the federal government are to be met. One of such is the fact that in states where there has been, a demonstration of political leadership, it has helped to send the right signals to citizens. So doubts or questions have been addressed just by that symbolic action of a state governor coming out and his family or members of the cabinet to take the vaccine. It has helped to encourage a lot of people to come. This is one deficit in some states where the states have either directly or impliedly condemned the vaccine and raised doubts or questions about that. In states where these agencies have also collaborated, so where we have had inter-agency collaboration between the State Primary Health Board, Ministry of Health, that has also sort of helped the sending the right signal, but it has also helped to coordinate and improve the efficiency in the deployment and targeting of for the vaccine in those states. These, I think, have worked well. There's also been mention of partnership between state agencies and civil society groups and media as something that has also helped in the states that are doing well. An example is Kwara State, that actually commended the support that they have received in the states. But by and large, there are also concerns that the level of vaccination is still extremely low. In Kwara State, where that is tagged as one of the top 5, I think the level of vaccination is just about 12%. That's still a lot, extremely low. And so the question now that we are asking and hoping that this conversation this morning will help to address is to fashion out, how can we raise that between now and March, when in order for government to be able to meet its 70% target.
Amina Ibrahim, GTV Africa.